World Health Organization has warned that there is a high risk of polio spreading in Guinea and Mali after a Guinean toddler recently traveled to Mali and became the country's first case of the crippling disease in more than 4 years. A polio vaccination campaign has been launched to stem any polio spread in both countries.
Nigeria has reached a milestone. The World Health Organization has removed the country from the list of polio-endemic countries. The WHO made the announcement recently in New York. This means 2 countries remain endemic, Pakistan and Afghanistan. Meanwhile, Mali is on high alert. Authorities have started a mass polio vaccination campaign to avert any cases of a crippling vaccine-derived polio virus that could spread in the country and in neighboring Ebola-ravaged Guinea. The virus was detected after a Guinean toddler traveled to Mali and became the country's first polio case in more than 4 years. In Mali, near the Mali-Guinea border, health workers are going from door to door vaccinating all children under 5. Fatoumata Coulibaly is a resident of Mali.
I ask all women to vaccinate their children to avoid this disease. Don't refuse or hide your children. Polio makes your child miserable. Your child will stay in the house and will not be able to walk.
The new case recorded in Mali was caused by a strain of the virus known as type 2 that had come from a vaccine. Preliminary tests showed the 19-month-old was paralyzed on July 20th, 7 days before being brought to Mali for treatment. Vaccine-derived polio infections are caused when the virus spreads after being excreted by people who have been immunized with live oral polio vaccine. Unvaccinated children and people with low immunity are then at high risk of becoming infected via contaminated water and sewage.
For Mali, we can say today that we congratulate our health personnel because the case has been identified in Mali, but it didn't come from Mali. That is clear. Because of our system of monitoring and our performance, we were able to control the virus and take immediate action to rapidly stop it from spreading.
And as the world moved closer to its goal of eradicating polio, specialists warn such vaccine-derived cases could jeopardize the progress.
This is an exceptional situation which could happen when the vaccination coverage is low, because in vaccination there is a group immunity. Once we have a high coverage of vaccination, other children will be protected as well. But once the level of vaccination is low, this could put us in a situation like the one we are facing.
Vaccine-derived poliovirus outbreaks are rare, but pose more of a risk in populations where health systems are fragile and immunization coverage is low. Polio is a highly contagious disease that has no cure. It attacks the nervous system and can cause irreversible paralysis within hours of infection. Mass campaigns as well as routine immunizations continue in affected countries to strengthen immunity among various populations.
Well, that was Moudou reporting.